joining us here at Central Vermont, and I'm going to I wanted to give you an update. We want to give you an update on some of the progress that we've made since January on opiate addiction and addiction generally. But I'm going to let the folks here who are working so hard on this introduce themselves. I know you know many of them, but Dr.
Mark Detman,
from
Central Vermont Medical Center, Director of the Emergency Department.
And he'll be speaking here. All of these folks you're going to hear a little bit from, I hope. Angela.
Angela Shea. I am an expert clinician here in the emergency room at Central Vermont Medical Center.
Annie Ramiciano. I'm the new Director of Pretrial Services.
I'm Bobby Sand. I'm the Governor's Liaison to Criminal Justice Programs.
I'm Tommy Lesperance, the Commonwealth State Police.
Andy Pluto, Commissioner of the Department of Corrections.
Barbara Samaglio, Deputy Commissioner at the Health Department.
Bob Beck, Director of Mental Health and Substance Abuse Services at the Howard Center.
Thompson Patico, Chief Medical Officer at DEVA.
Brenda Gagnon, Director for Central Vermont Addiction Medicine.
Thank you all for joining us. And Barbara Samaglio is kind enough to MC this event. I just want to make a couple of quick comments to help bring you up to speed on some of the progress we're making. As you know, it's my belief that there is nothing that could destroy Vermont's quality of life more quickly than if we ignore opiate, Oxycontin, heroin addiction in our state. And since January, we've worked very hard as a team to try and change the discussion from one where we stigmatize folks who are addicted, make them line up for treatment, don't take care of them when they do need treatment, and treat this disease differently than every other disease that we treat in Vermont. Or the new approach of saying, we're in this together. We know that law enforcement alone can't solve this problem. And we must treat it as the disease that it is, moving folks whenever we can into treatment, back into a productive life in Vermont. So what are the steps that we've taken that have made some progress? The folks here who are working so hard in this effort in a cumulative way are going to talk a little bit about some of the progress we've made, but I want to mention 7 quick points. Treatment. As you know, when we addressed this issue in January, we had hundreds and hundreds of Vermonters lining up for treatment. Folks who were addicted, had hit rock bottom, were often committing crimes to feed their habit, and when they said, we want treatment, we said, sorry, get in line. We've been building out treatment centers across the state. We have moved 1,700 folks. We have today, we're now treating 2,500 folks that we were not treating before we launched this effort. So do we still have some waiting lists? Yes. But the good news is that because of the increased awareness to this issue, we're finding that we're bringing more people into treatment who were formerly abusing and using on the streets. And it's good news that we are now reducing waiting lines and treating many more people than we were in the past. My team will talk a little bit about that. Secondly, we've launched a regional effort with the governors in the Northeast, New York, to work together to find ways to deal with cross-border issues and other challenges that are feeding addiction throughout the Northeast. And I want to thank Governor Deval Patrick for calling us together in Massachusetts to work together with the other Northeast governors to make great progress on a regional basis. Third, I have the pleasure with Governor Sandoval of Arizona of co-chairing the National Governors Association's Drug Abuse Academy. And we have found that by bringing this issue to the national front, governors coming together, bipartisan governors coming together, that we have consensus that Oxycontin and other pain addiction medicines have been driving heroin addiction, driving opiate addiction, and that we have a 50-state challenge where governors can work together to learn from each other and to change the way we do business to treat this as the disease that it is. So I'm grateful to Governor Sandoval and the NGA for their work on that. Fourth, the pretrial risk assessment, or rapid intervention, whatever you want to call it, that we launched in January is working. What that means is, in short, plain English. Instead of, when folks bottom out, usually when they're busted, that's when you're most likely to get someone to admit they have a problem, come out of denial and seek treatment. That is the chance where you're most likely going to succeed in moving someone in treatment. In the old system, it would take months to wind your way through the court system before you finally came to justice, and by that time, in most cases, addicts were back using, abusing, and back in denial. Our new system changes the way we deal with addiction. We make a third-party assessment. The prosecutor then has the choice. If it's someone who we deem not to be a threat to the public, which is the vast majority of addicts, we give them a choice. They can go into treatment, have wraparound services, get the help they need, and never see a judge, never see a court or judicial process if they succeed in that recovery effort. We have now moved pretrial risk assessment to 4 new counties: Addison County, Rutland County, Lamoille County, and Windham County, since we launched this effort, and more prosecutors are coming on. So we'll have an update on that progress, but pre-trial risk assessment making great progress. 5th, we held a statewide forum in Montpelier that brought together community members, prevention folks, law enforcement, judges, you name it, we were there. Since then, we've had 10 local action forums that have included over 500 Vermonters coming together to determine how in their local community we can do better with reducing heroin and opiate addiction. 6th, we distributed Narcan as widely as any state in the country. We got it out, we literally got 1,175 kits out to law enforcement, to prevention folks, to treatment centers. I know Bob Bick will talk about this, but the Howard Center alone has given out over 500 kits. Our law enforcement, Vermont State Police, has given out hundreds of kits. We have saved, as one example, at the Howard Center, 67 lives since we started aggressively getting Narcan into everyone's hands. So just think about that. The Howard Center alone, in just the work that they're doing, since we launched this effort, has saved 67 lives. And finally, we've instituted a pilot project in our prisons that Commissioner Polito will talk about that we think is going to deal with treatment in a more effective way for those that are addicted and incarcerated and give them a better chance of recovery when they're released. So this is a long journey. We are not going to eradicate opiate addiction in Vermont overnight. This is not easy work. What I can say is that the progress that we have made since January exceeds my wildest expectations, and I'm incredibly proud of the team that I'm standing here with and so many others that are out in the field right now battling this challenge. We've got to keep moving forward. So thank you to all who are here, and Barbara, we'll turn it back over to you. Take it away.
Good morning, everyone. And what I'd like to do now is just say a little bit more about the broad effort that we're undertaking here in Vermont, and then give you a chance to hear from the individuals that are leading different portions of this. I want to start back with something the governor talked about as the forum on opiates that took place back in June at the State House. We brought together a few hundred people at that time from all over the state to look at all facets of addiction: prevention, intervention, law enforcement, recovery. And we did that because the governor recognized that we're never going to get ahead of this program unless we all work together, and not just at the top, but also in the community. And so we began with that statewide forum, an opportunity for people to learn from each other, learn about some of the best practices, and most importantly, get involved and be part of the solution. And so the governor referenced that we've had 10 follow-up meetings so far, including over 500 people in local communities working on their very own plans for how they're going to improve their efforts with youth, with families, with all aspects of the community. Our goal is to have forums all around, so there's a couple more to be had, and then we're going to have some report backs in which these communities are going to talk with us and with the governor about what the most important steps are that we need to take together. So we're very excited about that, and I think it underscores that you're going to hear about a lot of pieces, that we're really trying to make the whole greater than the sum of its parts. And I don't think there's any other state that's doing even near the work that we're doing in terms of a holistic approach. I do want to go through and give everyone a little chance to say more about their individual pieces. The first area we're going to hear about is the expansion of the drug treatment programs. People have heard of our CARE Alliance for Opiate Addiction, affectionately known as the Hub and Spoke. And we have two people here with us today that are involved in services right here in Washington County and in Chittenden County. So I'd like to invite up Bob Bick of the Howard Center and Brenda Gagnon of Central Vermont Addiction Medicine to just say a few words about the work that they're doing and the difference that it's making in their communities.
Thank you, Barbara. I think that one of the most important things that's happened in the past 6 months is that we have significantly decreased the wait list that we once had. At one time, we had about 150 people on a wait list who were waiting for services, and we did manage to get that down below 20 people. And ultimately what that meant was when somebody came in and they needed treatment, they got it as fast as we could possibly get it to them. We've done some amazing work. We've been able to implement more therapeutic groups for people. And we've also participated in the naloxone pilot and have been able to distribute many kits to people, which I believe have affected them greatly.
Good work.
Thank you.
Good afternoon. It's great to be here and be able to report on having made significant progress on this issue. In the Chittenden clinics in Chittenden County, we've seen a 30% increase in the number of patients that we've been able to serve since the week before the governor's State of the State address and the infusion of some additional resources that the governor made happen during the last legislative session. So we were serving 722 patients the first week in January. We now have 932 patients actively involved in treatment. Those are individuals who are no longer out on the street committing crimes in order to support their habit. It's true that we still have an active waiting list, but we're aggressively taking more individuals in more quickly. So right now we're taking individuals for intake and orientation at about a 40% increase over the rate that we were able to do that just about 10 months ago. So we're making progress. We still have a waiting list. The active and inactive waiting list is about 50% of what it was 10 months ago. That's not to say that there are not individuals who are seriously in need of accessing care. But with our accelerated rate of bringing them into treatment and the resources that are being brought to bear, I think we're making the kind of progress that we would hope to make with this very significant and intractable problem. Thanks.
The governor also talked about his work with the National Governors Association and Governor Sandoval. We recently had a team that went to a planning meeting as part of this policy academy in which we worked with 6 other states to develop strategic approaches to working with prescription drugs and opiates. And we have a couple other folks with us today that were part of that team, and I'm going to ask Dr. Simpatico and Bobby Sand to come up and say a few words about the policy academy.
When you do these jobs, you go to a lot of these meetings, and we've been saying amongst ourselves that this last one really kind of stands out for a lot of us as giving us the sense that it's really linked to product that's going to actually happen in a pretty robust kind of way. So we're all pretty jazzed about how it's going to help accelerate the work that's already been happening, and how Vermont is really kind of leading the charge nationally in this regard. You heard a bit about the hub and spoke. We're really trying to fortify that process from a lot of vantage points, and one of the vantage points is to keep the front doors open, the hubs open, by helping to assimilate people who have been stabilized into the primary care community across the state. And the more effectively we can do that and help the primary care community view the treatment of folks that have been stabilized with opiate replacement therapy as a kind of a staple of primary care, the easier it will be to keep the doors open for people who are unstable and are just accessing treatment for the first time. So we're all very excited about this. People are looking to Vermont as a national leader in bringing this about, and we're very hopeful that we're not going to disappoint.
The biggest takeaway for me from the Academy was that the dialogue has changed. And instead of demonizing and vilifying folks, there really is a new national feeling that these are people who, through treatment, can get better and can rejoin society. And we've known that in Vermont. To have that same feeling now on a national level is really heartening.
Well, Bobby's up here. I think we're going to ask him to talk about the pretrial services a little bit more and introduce our new director for the pretrial services program.
A little historical background. After the governor's January 2014 State of the State address, Senator Sears and his committee modified what was then known as S-295, the pretrial services bill, to bring it in alignment with the governor's vision. That passed the legislature as Act 195. And let me report on some of the progress we have made toward implementation of Act 195. That bill created for the first time the position of statewide director of pretrial services, and I'm happy to introduce to you Annie Ramniciano, the first statewide director of pretrial services in Vermont. Annie started yesterday, so she is now a seasoned veteran of pretrial services. Annie is a former clinical director at Spectrum, has extensive experience in treatment and supervision, and is going to be exactly the right person to implement this new statewide program. The Department of Corrections has issued its RFP, request for proposal, for the pretrial monitors. Those, the bids for the contract positions will be due in the middle of October. So we're making progress on hiring the pretrial monitors who will work throughout the state of Vermont. There is a group meeting to do mapping of available community resources as required under the bill, and that work will be done soon. There are discussions with the judiciary, the state's attorneys, and the defense bar about the training in working with the new instruments, and that training will happen before the end of the year. And as the governor already alluded to, prosecutors are continuing to develop and expand the pre-charge or RIC model, which is really pioneering in the state of Vermont. Did you want to say anything about your first 2 days on the job?
I'm totally excited and thrilled to have this opportunity and to continue to build Vermont's brand as a national leader in all areas.
So we've also heard a little bit about the naloxone program, and another partner in that work, very important partner, is our state police and local law enforcement. So I'd like to ask Colonel Esperance to come up and talk a little bit about how we're working with law enforcement and emergency medical personnel to spread the naloxone kits around the state.
Thank you, Bob. Thank you. In many ways, the governor's words and actions have thrust this into a national spotlight from a law enforcement perspective. Wherever I go in the country now, Vermont's at the tip of the spear. And invited the governor to D.C. with me in February. He just assured me this morning that he would come, so we appreciate that.
Hey, don't tell them that. I'll call it a vacation.
No vacation. I was working the whole time. But the naloxone program, all troopers are now carrying naloxone. In fact, the trooper out of Middlesex Barracks, Chris Brown, saved a life over the summer. And that was the first, not long after he was trained in carrying the naloxone. So that program will be successful. I anticipate troopers using, unfortunately, naloxone more than what we would use or utilize our skills to save someone from a heart attack, unfortunately. But from a drug task force perspective, we're now able to totally focus on individuals and organizations out of state that are responsible for bringing product into the state, and then focus on the higher level dealers in Vermont that enable those from out of state to come in and set up shop. So we certainly appreciate everything that the governor's office has done to allow us to do that. Thank you. Thanks, Carl.
We've also been looking at the number of people who come into our correctional institutions that come in with a pretty advanced addiction. And we know that when they enter correctional institutions, oftentimes we struggle with, should they be detoxed? Should they stay on their medication? How should we handle this? And so I'd like to ask Andy Polito, the Commissioner of the Department of Corrections, to talk about what we're working on in order to support a better continuation of the treatment that these inmates are receiving as they're coming into corrections. We're just beginning a new pilot in 2 of our sites.
So I have to start this by giving the nod to Bob Bick at the Howard Center. The department has had a long-standing policy where if you were on a maintenance drug for addiction, we would transport you to the local clinic and put you in a van. It was resource intensive. It wasn't particularly safe and probably a little bit inhumane, but rather than wean everybody off, we would use this as a process to allow people to stay on their maintenance drugs while they're incarcerated. Bob came to the department about a year ago and asked us to rethink that policy, and under the governor's direction, of course, we wanted to do anything we can to help with this effort. And so starting in October, as a result of a piece of legislation and Barb's hard work, we're going to start the delivery of medically assisted treatment in St. Albans and Chittenden. And so, actually I have that wrong, it's Rutland. Rutland and Chittenden. And so anybody who is male on a medically assisted treatment will be lodged in Rutland or live in Rutland, and of course all the females are in Chittenden. And so out of those 2 correctional facilities, we will deliver treatment within the facility, and people will not have to leave the confines of a correctional facility to be maintained on these drugs. And so this is a really new program for the department. It's not necessarily new in corrections across the country, but new for the department. And so we have to report back to the legislature as we go, and obviously we're going to monitor this as we go along the way.
One of the most important things that we do in working with people with prescription drug use is monitoring the controlled substances that are being distributed to patients. The health department operates the Vermont Prescription Monitoring Program, which has been a very effective tool to allow physicians to better understand what medications their patients are receiving, if they're receiving medications from multiple physicians, with the goal of better coordinating care. We have struggled to keep up with all of the demands and the changes in the system, and I'm happy to announce that we recently received a $300,000 grant from the Department of Justice to enable us to further develop our Vermont prescription monitoring program. So this is a tool that is really, a technical tool, but one that we could not do without in helping physicians better understand what's going on with their patients. So I want to mention that as, we are very pleased for the federal government recognizing that additional support will really make a big difference for us. Last but not least, I think I've got everybody here. Last but not least, I want to thank deeply Central Vermont Medical Center and for hosting this press conference today, but also in particular Dr. Mark Dettman. He and his associates, Angela is with him today, are working on a very important project with us, also as a result of a federal grant called SBIRT, Screening, Brief Intervention, Referral to Treatment. We've been talking a lot today about community work, about treatment, about enforcement, and all the tools. But the reality is many people are very severely affected by addiction by the time they ever get any help, or unfortunately they end up with Department of Corrections or on the road under the influence. And we know we have to start earlier in order to intervene. I want to ask Dr. Dettman if he would come up and talk about the work that they're doing right here at Central Vermont to screen and intervene earlier with people who might be struggling with alcohol or other drug issues.
Great. So in the medical model, the boots really hit the ground when it comes to senior patients, whether that's in a medical home, an obstetrician's office, or in an emergency room. That's where the magical work has to get done if you're really trying to identify and influence people's behavior. And this SBIRT grant's helping us strive to do that by helping set up some pilot projects around the state in some of the federally qualified health centers, university health centers, and our emergency department acting as a pilot project. The goal is to screen every patient that comes through the emergency department for risky substance use. And this is everything, tobacco, alcohol, and drugs. We marry this with touching base with every patient about other safety aspects of their lives. In, distracted driving, we're preparing people for the new law in October. Seatbelts, helmets with outdoor activities, and things like that. That helps round out the approach we're taking. When we identify somebody who is really using substances, especially alcohol most typically, in a responsible way, we give them positive feedback about that. Every patient gets that. Anybody who's identified as having some risk, and the risks are health risks, health risks for medical illness, for accident and injury, for a socioeconomic disability based on substance abuse. If they identify as that, they're approached by a SBIRT clinician like Angela, who digs a little deeper, does some deeper screening, and really looks at how significant their risk is. Sets up a dialogue with them, asks them where their willingness to change and adapt is, and then engages them in a conversation that leads towards some self-motivated change. The grant's allowing Angela and her colleague, Ginger, who are working full-time in our ER, to actually meet with patients outside the emergency department up to 5, 7, 10 times afterwards to consolidate that work. And they often bring family members, and the age ranges of those folks ranges from the 20s into the 70s, I believe. It's been extremely gratifying. The patients have reacted to this extremely positively. They like hearing about this. They like something to talk about while they're waiting in the ER. But it gives them and their families and their friends an opportunity to really start to talk about some of these issues and gain services that we can provide to them on the spot. Angela can say, I'll see you tomorrow to talk some more about your alcohol use or your marijuana use, or your inappropriate prescription drug abuse. So we're extremely happy with this. It's been a great success so far, and we're really happy that the Department of Health has really pushed this forward.